work for, as an intern, 36 hours in a row, and everything was fine. And I think looking back, everything was probably not fine.
I feel like, do I have a disorder? Like, do I need to go to a neurologist because I have just forgotten the case I saw that morning?
Learning how to work with our thoughts and learning how to work with our brains is really important to balancing out the stress of the work and giving ourselves a bit of a break so we can find the pause button. One of the most important things we can do is learn how to really intentionally use our brain and our breathing in order to support our mental health, because everything starts in the brain. It's the command center for everything that we are and everything that we do. And that's where we also get into a lot of trouble. So we are professional thinkers. It's what we do every day, and we can get really lost in our thoughts. And it's very challenging then to stop the constant cycling and stop the worrying and stop the rehashing and rehearsing that comes out of being a very busy professional, where overwhelm and chronic busyness and the desire to serve is always at such a high level. This sort of pace and this sort of stress almost becomes a badge of honor. Mm-hmm. Which is not healthy for any of us, but then it makes it very difficult for us to check in with ourselves about, is this really normal? Am I doing as well as I think I'm doing just because I'm working 12 or 14 hours a day and getting through my cases and managing my patients as effectively as I can? Am I at the top of my game?
I can remember driving home some mornings and feeling intoxicated at the wheel, which is not good for anybody's safety. But definitely even recently doing swing shifts, just feeling completely just out of sorts the next day and not functioning the way I'd like to be functioning.
So when the brain is overwhelmed, it can't focus. So when we feel like we're doing so much multitasking that we're not getting anything done effectively, that's a stress response. That's not just that the workload is high, it's a stress response when we can't concentrate.
Someone will bring up a name of a patient and you think, did I see that case today? And then I'm thinking, oh my gosh, I might have a disorder right now. And so then that is telling me to myself that I may not be doing very well right now. I am a little on overload and I need to take a step back. And so I think part of that, when you start seeing some of those warning signs, now that we know what they are, is doing those self-checks. Yeah. And saying, I heard something about that, I need to do a self-check and take a step back.
What's a takeaway tip for putting a pause in there and stopping that cycle?
Breathe.
Breathe.
Breathe, which, a deep belly breath will kick in the parasympathetic nervous system. It actually cues a relaxation response. It gets your higher brain back engaged. When we are frenetically busy, really overwhelmed, we are not operating with all of our best tools on board because we actually are bypassing the neocortex in our brain. So breathing will cue a relaxation response. It actually gets you out of your amygdala and back into your higher brain so you can think clearly, so you can consider if really what's going on is high risk or not. Should I be as concerned as I am right now? And then you can think your way through it and problem solve.
Sometimes on a really hectic day, if I am just really crazy, I'll just walk out the back door and just take a deep breath and look at the sun. And sometimes it's just a few seconds and come back in, and that's regenerating, So I think even doing that can be so helpful for the mind.
And when you realize you haven't breathed deeply, to stop what you're doing for just a moment and take 2 or 3 deep belly breaths. Make sure that your abdomen is rising and falling with the breath, and then proceed with what you were doing. So learn to manage in your body and recognize in your body when the stress is getting to be too much.
Sometimes it's that deep breath, right, that we take in between.
Totally.
Before we say the wrong thing, it's taking that pause,
yes.
making that moment.
Yes, exactly, that mindful moment.